I'm here with others at this conference to announce the launch of a new trial in the United States. This new trial will be supported by the Alzheimer's Association. It will be conducted across the United States. And what's really important about this trial, it allows us to test an intervention that has been tried, as Cindy just mentioned, in Finland. And when the results reported a few years ago, we are now with this new opportunity with U.S. POINTER. We have the opportunity to test whether this new lifestyle, it's a complex combined therapy lifestyle intervention, can prevent cognitive decline and dementia in Americans. So lifestyle as an intervention. We have learned that interventions focused on improving health of the body may also protect brain health. The body, like any machine, fine-tuned machine, needs care. So years of disrepair of the body due to sedentary behavior, poor diets, has multiple negative consequences on the body, including conditions such as obesity, disorders of the metabolic function, such as diabetes, and also cardiovascular disease. Until recently, many of us who studied lifestyle and its impact on prevention of cognitive decline focus on one lifestyle intervention at a time, such as aerobic exercise, a certain diet, cognitive training, for example, or aggressive monitoring of medical conditions. As Cindy said a moment ago, the finger trial results were reported 3 years ago. Dr. Kivipelto is here with us today, and she is a partner in this new study that the Alzheimer's Association is launching. I think it's important to note that this complex or combination lifestyle intervention that showed promise of reducing or protecting brain health did not involve an investigational drug. We all know we've had hundreds of animal studies and showing promising therapeutic targets or effects, but we are yet to identify a pharmacological intervention with disease-modifying effects. The finger trial generated much worldwide interest. Now there are many countries in process of replicating, adapting the finger trial model, this lifestyle intervention, and to the country-specific culture of the country and testing it in a large, diverse population. U.S. POINTER allows us to be part of that team. So this study is being launched by the Alzheimer's Association with a $20 million commitment. This global effort that we will be part of will allow us to partner with others in Europe, China, Australia, Singapore, and just recently, China. I have China in there already. Okay, that's new news. This global effort, of which we will be a part of, allows us to harmonize our methods, our metrics for success, our data collection strategies, and our sharing so that we can magnify or maximize our impact on a global scale and hopefully identify a new strategy to prevent cognitive decline and dementia in a large, for people from all backgrounds. The leadership of this trial is diverse, has many different types of expertise. It comes from different institutions across the United States. Wake Forest School of Medicine will be involved with experience in conducting clinical trials and exercise expertise. Kaiser Permanente will be involved in Northern California in particular. University of Southern California for the Alzheimer's Therapeutic Research Institute of San Diego, Rush University, Karolinska Institute, and the National Institute for Health and Welfare in Sweden and Finland, and the Alzheimer's Association. So this is a large team, and the important point is we bring together expertise from many different areas and many different parts of the country so that we can pool our team efforts to conduct the trial. 5 to 7 healthcare networks across the United States will be engaged. One of these networks will include North Carolina. North Carolina, one of the largest accountable care organizations, has already agreed to participate. This study will include 2,500 adults aged 60 to 79 years old. They will have some presence of some health condition that increases the risk for cognitive decline. They will all have a family history of significant memory impairment, Alzheimer's, or other dementia, and they will not be currently exercising. We are going to be using a medical record search on our first phase to identify people who might be eligible for the trial. So in general, our general procedures, we will identify candidates using multi-stages, medical records, questionnaires, follow-up telephone calls. It's important that we find the right people for this trial. They need to have some room for improvement in terms of their body and the body health, so that if they are the healthiest folks, these are not the people that we want to target for this trial. We'll have many different kinds of assessments of cognition for the duration of the 2-year trial, so at baseline and every 6 months. We have a very intensive accountability tracking mechanism that will be put in place to be able to monitor the intervention adherence, how well they're sticking to the prescription of their intervention. This is a key element in any trial that involves a lifestyle. How well are they adhering to the intervention? We expect to start enrollment early in 2018. So the interventions. The multi-domain, the active intervention that is modeled on the finger trial from Finland. The multi-domain lifestyle intervention. It includes 4 components. Exercise, mostly aerobic, but will include other strength, some resistance training and stretching and balance 4 times per week. Nutrition, we will support our participants to change their diet towards the MIND diet. Cognitive stimulation, this will involve some computer training at home, but also group sessions to encourage cognitive stimulation. And also frequent exams for medical monitoring of comorbidities and feedback and goal setting, so the participants can play a role in the repair of their own health care. So the control group, the health education and support, 3 to 4 annual meetings per year for general health education and physical exams annually. The innovation, older adults at increased risk for cognitive decline will be targeted. We will engage community partners across the United States to help with intervention delivery, including the Alzheimer's Association and organizations like the YMCA. We will develop applications, electronic applications that will help us during the trial to provide feedback to participants on how am I doing in terms of my brain health in this trial. But these applications will be easily transitioned for widespread distribution when we have the results of the trial at a later date. And then finally, the Alzheimer's Association, this trial allows us to participate in the worldwide consortium. Worldwide Fingers will be the new name. Thank you.